Good morning. Today we will be discussing on the topic tooth preparation for full metal crowns. As we all know, the tooth does not have a regenerative property. So the restorative material should replace the lost enamel or dentine because of caries. And in order to receive the restorative material, it should have some space. So for that, we are doing the tooth preparation. And um, coming to the definition of tooth preparation, it is defined as the process of removal of diseased healthy enamel, dentine, cementum to shape a tooth to receive a restoration. So this is the classification which is on principles of tooth preparation. This is there in the Rangarajan. I'm not going to detail. So basically there are three principles of tooth preparation, that is biological, mechanical and aesthetical, based on which we prepare our tooth. And there are certain armamentarium which is required while we are doing the tooth preparation. The first one is a rotary, high-speed rotary instrument, a water cooling should be there, which is extremely important, and it should be well directed. And rotary cutting instruments like stones, carbide bars, and drills are required. So a coarse diamond burr is used for depth orientation, groove, and gross reduction of the tooth structure. But a fine diamond will be used for final refining of the preparation. And the depth of preparation and the configuration of the prepared surface is determined by the diameter of the rotary instrument that we are using. So in a tooth preparation kit, it should have a round and taper diamond, flat and taper diamond, long thin taper diamond, that is a long needle burr, a short needle burr, and a wheel burr should be there for a tooth preparation. Coming to the full veneer crown or completed crowns. So what is this full veneer crowns? We know there are two types of crowns are there. Full veneer, which will cover all the coronal tooth structure, mesially, distally, facially, lingually, and occlusally. The other one is partial veneer crowns. So that is of 3/4 or 7/8 crowns, like that. So we will be discussing about the full veneer crowns today, and it can be made of full metal or ceramic, or a combination of metal or ceramic. So the advantage of full coverage crowns is that it replaces the tooth structure and imparts some measure of structural support to the tooth, and it covers the coronal surface of the tooth. Coming to the advantage, it has excellent resistance and retention, and it will alter the tooth form and occlusion. Coming to the disadvantage, it has extensive tooth preparation is required, and the margins will be near to the gingiva, so proper maintenance is required. Coming to the indication, in the case of a crown, it will be given in an endodontically treated tooth, fractured tooth, if extensive caries is the defective restoration is there, and if we want to change the contour of the tooth for the retention of the removable partial denture, or that scenario, we will go for a full coverage crown. In the case if we use a retainer for FPD, such as short abutments, long span fixed partial denture, and abutment alignment need to correct, all that situation will go for full coverage crowns. And it is contraindicated in poor oral hygiene and the young individuals who have a pulp horn at a high level. So all metal full veneer crown preparation. Today we will discuss about this in detail. So the armamentarium required are a aorta handpiece is required, round and taper diamond burr is required, a thin short needle burr is required, and topped out diamond burr and base plate wax of 2 mm thickness is required for this. So before going to the preparation, we have to prepare a putty index. So why we have to prepare a putty index? That is mainly for to check the amount of reduction that we have done, and that will also will be a guide for the beginners. So we will take half scoop of catalyst and activator paste. We manipulate the elastomeric putty material, and once that material is in the proper consistency, place it over the tooth that we are going to prepare. At least cover one adjacent tooth. Once the material is set, remove that into labial and lingual half with a BP blade, and we can place it over the tooth, and we can use to that for the amount of reduction during the tooth preparation. So this is the picture of the putty index. Once that is set, we cut that into labial and lingual half, so that we could able to identify the amount of reduction that occurs. After occlusal reduction, we can keep this index back onto the tooth and we could able to check the amount of reduction that we have done. So steps in preparation, tooth preparation. There is this occlusal reduction is the, axial reduction is the, proximal reduction is the, finishing, and buccal seating grooves are the. So first one is the occlusal reduction. What is that? It is just the reduction of occlusal surface, but the reduction will be done according to the needful. Like for a metal crown, the functional cusp will be 1.5 mm reduced, and the non-functional cusp will be 1 mm. And a round and taper diamond burr is used for this purpose, so that will create a chamfer finish line. So coming to that, first we have to prepare a depth orientation groove on the occlusal grooves. Depth orientation cut of 1 mm is placed. After that, a depth cut are placed on the triangular ridges from the cusp to the tip to the base. Once the depth orientation grooves are placed, remove the tooth structure in between according to the anatomy, following the contour of the natural tooth. So this will complete the reduction in a evenly. So once the depth orientation are placed on the occlusal grooves as well as on the triangular ridges, once that is done, the reduction of the tooth structure is done. And we can place a base plate wax of 2 mm in between and ask the patient to bite. If there is a light spot is there, it's indicating of inadequate preparation or space. So we have to prepare the tooth structure and again recheck with the base plate wax, and the putty index can be also used to analyze the amount of tooth preparation that we have done, tooth reduction that we have done. So check the occlusal clearance with the putty index as well as with the wax. Now coming to the axial reduction, this is mainly done on the facial and lingual surface. So the amount of reduction required is 0.8 to 1 mm and cervically 0.3 to 5 mm. So a rotary instrument like a round and taper diamond burr is used for this. So after we will take a round and taper diamond burr of 2 mm diameter and we sunk half the diameter of the burr. So that will create a 1 mm preparation with a chamfer finish line. So initially we should always place a depth orientation groove. After that, we have to remove the tooth surface in between, which will create a even reduction of 1 mm will be given with a chamfer finish line. Now coming to the proximal reduction, that is during the proximal reduction, you should be careful about the adjacent tooth. As we all know, in biological principle, we have explained if we do injury to the adjacent structure, tooth structure should be avoided, as there is any kind of nick or something has occurred. It will cause plaque accumulation and cause caries to that tooth. So to avoid that, we can always use a short needle burr. The needle burr should be used in an occlusogingival direction. A sewing motion should be done in the facial-lingual direction. So it will move facially, lingually, and it will form a lip of enamel that can be removed with a prop. Once that is removed, there will be space for the round and taper diamond, and we can finish the refine the finish line with a round and taper diamond burr. So once that is done, the final finishing is done with a end cutting burr, a torpedo diamond burr, and with a fine grit. Now coming to the buccal seating groove, this kind of grooves are given for the purpose that it will avoid the rotation of the prosthesis during cementing, excessively tapered tooth, tipped teeth, and long span fixed partial denture. And additional grooves can be placed for retention. So that will be placed on the facial surface parallel to the path of incision. A flattened tape on the facial surface, and the final finishing is done with a fine grit diamond burr. So this completes our preparation. Once that is done, we will proceed with the impression, and we'll go for the fabrication of crown. So these are the steps in the fabrication of full metal complete crown, complete veneer crowns. So the longevity of the restoration mainly not depending upon the material that we are giving to going that we are done. So always stick to the basic principles of tooth preparation and do the preparation according to that. Thank you.